From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. Hey folks, welcome back. As our pets get older, they may not chase the ball like they used to, or could be hesitant to climb the stairs. And it's easy to chalk it up to just getting older, but sometimes these changes can be signs that they're dealing with chronic pain. And recognizing when our dogs are in pain can be pretty tricky. They're really good at hiding it, so being aware of subtle shifts can clue us in that something's up. Understanding these signs early on means we can step in and make their golden years as comfortable as possible. Today, we're joined by Dr. Monica Tarantino. She's a rock star veterinarian with a special interest in senior pet care. Dr. Tarantino co-founded the Senior Dog Veterinary Society and created Senior Dog Revolution, both dedicated to improving the lives of our aging canine companions. She also contributes to platforms like The Spruce Pets and Pet MD, sharing her expertise in geriatric pet health. She's here to help us spot signs of chronic pain, explore ways to manage it, and ensure our senior dogs continue to live their best lives. So, grab a seat, maybe call your senior pup over for some love and extra cuddles, and let's get into it. Welcome, Dr. Monica. I'm so excited to have you here. I want to hear all about how you got into caring for senior dogs.
Yeah, well, thanks for having me, Antonio. I really appreciate it.
Yeah.
So senior dogs, to be honest, the first time I actually got into senior dogs was when I had my first senior dog, which was a Westie named Frodo Baggins Tarantino. And he became a senior when I was actually in vet school, and he hit age 10. And what happened for me was that he was a healthy dog most of his life. And then when he hit age 10, all of a sudden, we had all of these different issues coming up. We were in the vet nonstop. So he had neck pain, he had collapsing trachea, he had a heart murmur that popped up. And I kind of just started seeing myself like watching my dog that I'd had for all of my 20s and 30s start just deteriorating in front of my eyes. And I realized at that time that I wanted to have more information and more knowledge about senior dogs and really dive into that and help pet parents help their old dogs age well, age in a healthy manner,
Gotcha.
and have a really comfortable life.
That's awesome. How long have you been in veterinary medicine prior to this?
Yes, I've been a vet for over 10 years now. I was in vet medicine, though, of course, the 4 years for vet school, but then prior to that for about 4 years too.
Okay.
So a long time.
Yeah. So was the Westie your inspiration to start the Senior Dog Revolution?
He really was.
Okay.
I mean, I feel like, and you tell me if this is true for you, but when I first got a dog, old dogs, senior dogs were like not my favorite. But once you've had an old dog, I think to know an old dog is to love an old dog.
I agree.
And so once you have that first senior dog and you go through that experience with them, you're like, wow, like these, once they get to this age, they're just so precious.
Yep.
And you're literally doing everything you can to try to keep them as happy and healthy as you can during that aging process.
Yep.
And so I just think they take on like a really special meaning for a lot of pet parents.
I totally agree. I think for most of us, and even thinking back, when I wanted a dog, I wanted a puppy. I wanted that lively. I wanted a companion that I can kind of raise to live the life with me and like have a lifestyle, go on hikes and things like that. But I can totally see, because I fostered a lot of dogs too and helped a lot of dogs in rescue to get adopted. And working with senior dogs, it definitely does hold like a special place in your heart because you see them. And honestly, it's very relatable to see just them aging, like as we age, you start to get up and it's like, I don't feel as comfortable. So it's very... It's a special bond, I think, that kind of happens when you start to care for them and see that transitional stage in their life.
Absolutely. And really well said. And I relate to that as well. When I was younger too, I just wanted a puppy. And then as I got older and started actually watching these dogs go through that process, it's kind of humbling in a way.
Yeah.
You're actually watching them age a lot because they age at a lot faster rate than we do.
Yep.
And you're seeing the things that maybe you start noticing yourself too. Like I'm a little achier in the morning, right?
Oh my gosh. Even when Logan gets up, I'm like, I hear you, buddy. Like you gotta move around and stretch a little bit.
Yeah.
So I know that dogs are really good at hiding pain. From my experience, I think it comes from a very primal instinct, and meaning like if the dog is showing pain in a pack, then they can become a victim to an attack.
Yeah.
So I think that there's this instinctual, involuntary way of them hiding pain.
Yeah.
Do you agree with that, or do you have like a medical explanation why dogs hide pain? Because we know that they do it really well.
Yeah.
But like, what's your take on like why they hide pain?
Yeah. I mean, I think it's a really good question. And to be honest, I think that trainers are some of the best professionals that actually help pick up on pain the soonest. Like I know so many trainers that actually are out there just doing a great job because it's so it's so tied into behavior.
Yeah, absolutely.
Right? Like, so you have an aggressive dog or an anxious animal and you're going out there to do training with them and help them with that behavior. It may not respond if they've got chronic pain, right? Because it's so tied into it. But yeah, I think the theory that you mentioned is probably the most common theory that they have out there, which is that animals are very, very good at hiding it, right? And part of that might be a survivability or an instinct type thing, because if you are the limping gazelle out there, right, in the herd, you're going to be picked off first. Even if you're the in a pack of dogs, if you're showing that you're vulnerable, you might have to have a switch in your hierarchy, right, in that pack. And so I think that is one of the theories out there about that I think makes the most sense for a lot of us. So tell me, I'm curious, have you had cases with training where pain was a really big component and it wasn't until,
One that comes to mind actually was a Shih Tzu. I went to the client's home, we did a consultation, and the way that they were describing the acute onset of the behavior change, I said to them, I was like, is it possible that she is hurt in any way? The issue was that the dog was not going up and down the stairs. It didn't seem to want to. And then when they would pick her up, she was being aggressive. And I was like, has she ever been aggressive before? Have you guys ever had any issues? They were like, no. I said, to be honest with you, I don't think that you're dealing with obviously it's a behavior change, but like the root is a medical issue. And I think you should have her looked at before we impose any type of training on her.
Yeah. And like you handled it that beautifully, to be honest. That's exactly what we want people, trained professionals like you, like doing out there. Like you help that dog. Right. And you mentioned right off the bat, you picked up on it right away, which was two signs that the pet was showing. One was reluctance to do stairs. Well, like, why is it reluctant to do stairs? Right. And then also the one where you pick him up and all of a sudden now, like you said, an acute change, it's kind of aggressive when you pick him up. So that's a perfect example of an animal with chronic pain. So I love that. I think that, chronic pain can impact animals in all of the different ways, right? We know that it impacts them as far as there's socially, right? They're not as likely to come hang out with us if things hurt. If it hurts to get up and move to go over and hang out with the family, they're also not as likely to walk around as much, right? So then their health starts going downhill because now they're also losing muscle mass at a faster rate because they don't feel good enough to walk as much as they used to. There's also, of course, psychological and behavioral changes, of course. And we know that, like with working dogs, for example, a lot of times if people are noticing, we have studies on this, if you're noticing changes in their ability to perform, or things like they're having more anxiety or more aggression out there, a lot of times we actually look at what's happening with those dogs is actually chronic pain that is the cause of those changes. So it actually prevents and affects like working dogs and dogs from being able to perform. That's huge. So it affects them psychologically, it affects them cognitively, of course. It affects them in every single way. So truly chronic pain will impact a dog's entire life, which is why I'm so glad we're talking about this today, because it's so important to just understand that and to recognize it. One of the most interesting stats, and there's a lot of different statistics on things like arthritis that are out there, and you can find different numbers. But one of the really interesting ones is, for dogs age 8 and over, about 80% of them may have arthritis. Is the stat you listen? That's a lot.
That's a
lot.
Is this preventable? Sorry to interrupt, but
I don't think it's per se preventable. So a lot of like the younger dogs that actually start having things like arthritis, a lot of the times it's because of their conformation. So it's the way that their joints and their muscles actually sit, and so that way that sits actually and works together when they move will actually cause joint degradation and cause the arthritis that happens. Things that can be preventable, like for potentially are going to be like large breed dogs. They really should be on large breed dog puppy formulas when they're growing up, right? Because that can actually, if you have diets that are too high in calcium, they can actually cause them to grow faster. A lot of people that get large breed dogs as puppies are like, I want them to be big. I'm like, hey, like, let's not say that. Like, we need to have a food that's appropriately a puppy food, a large breed puppy food that has the appropriate calcium phosphorus relationship so that they grow at the right rate. We don't want them to be really big, or they'll come in, they'll be really they'll be overweight as a puppy, and that will affect them as well. So certainly things like that can affect it and predispose them. But that's a really good question. So it's not, I don't necessarily think that it's 100% preventable, but I do think there are things that we can do to help slow down the progression and help support the animal's joints as much as possible.
On that note, is there any way that somebody would be able to know that their dog is in chronic pain? Like, what would be a suggestion you would have to a pet owner to say, hey, like, because let's just assume that they don't know what to look for.
Right.
So should they just bring the dog in for regular checkups with somebody like you or another vet, or is there certain things that they should look for to recognize whether their dog is in chronic pain?
Really great question. And I think there's several things that you can do. So first, the very first thing is one, being aware of chronic pain as an issue that these
Okay.
animals are going to face. Okay. And we just had a stat that we talked about that, dogs over age 8 tend to have about 80% of them tend to have osteoarthritis.
Yeah.
So chronic pain is likely happening if you have an older dog. They probably have some degree of chronic pain. Two is remember that it's really subtle. And so if you can get aware of the signs that are associated with chronic pain and the two most common places that I tend to see it as a general practitioner, then you're going to be just ahead of the game for your pet. So the two most common places that I tend to see it are going to be musculoskeletal disease, like we talked about, just the skeleton. Okay, so back, neck, joints, elbows, wrists, knees, hips, those areas. Lower back is a place we can commonly see, especially with shepherds. And then the second place that we see it is dental disease. Dental disease is huge. So many dogs have, every dog has dental disease to a certain degree, but so many of them will, as they get older, they have diseased teeth or rotten teeth that they have, and they can't tell you anything about it. And they do not show signs very easily. And so I think that's a place where a lot of people are like, what do you mean they're eating fine? They go and they eat
But also,
really easily.
are they though?
Yeah,
But
that's the
are they?
question, right?
Yeah.
You don't know. Like, you don't know. Is your dog just chewing on one side of its mouth on these two good
Exactly.
teeth that
Yep.
don't hurt it, and the rest, like, it hurts or it has a painful tooth like throughout its
Yeah.
mouth? So you don't really know. So those are the two most common places that we tend to see it. There are other places that you can see it too. So I'll briefly just touch on that. But like
Sure.
other things like if a dog has chronic ear infections and when they're not being kept up with, that can certainly be painful. If a dog is constantly itchy, I think that can certainly cause
Yeah.
a degree of chronic pain. You can also have things like glaucoma that can come on that can take weeks or months for people to even figure out that their dog has a headache or that it hurts them. And that can certainly be cause chronic pain. So there's other areas you can see it, but if you can just get familiar with the two most common places that we see it, you're going to be way ahead of the game when
Yeah.
it comes to helping your pet out.
Well, I always encourage my clients to like actually observe their dogs.
Yeah.
Because I think, I guess it can go either way, but in my experience, a lot of times people aren't paying enough attention to their dogs.
Yeah.
From my perspective, behaviorally. So, and I'll say to them, like, what happened? If there
Right.
was a fight or there was whatever it is, like, do you know exactly what happened? Like, oh, I wasn't there. And obviously, we don't expect people to be there all the time, but I don't think people pay enough attention in
Yeah.
a lot of cases to really know the difference between their dog being like in a healthy state versus in chronic pain, or noticing like subtle changes. Like, for example, eating. For me, I think there was no doubt that I would notice that my dog is eating differently because I actually watch them when they eat. I just like to observe my dogs.
Yeah.
So I would definitely pick that up. And, no fault to anybody who doesn't, but I think it's a good place to start just by paying more attention so that you can
Absolutely.
actually recognize those changes.
Absolutely. And I mean, and you're touching on something that's really important here too, because one of the reasons why we struggle so much in picking it up on dogs is because they communicate to us entirely through nonverbal cues.
Yes.
So like you're talking about watching your dog eat, that is so brilliant to do because they won't be able to tell you if something is hurting down there. So literally, how quickly are they going to the bowl?
Exactly. Yeah. How much enthusiasm is it? The same
Exactly.
as
Is it same as it usually is? Like those are very, really important things to watch out for, which obviously you do naturally because you're a trainer. So, but yeah, it's this fact that they communicate to us through these nonverbal cues. We're trying to pick up on these really subtle things. So something as simple as watching your dog eat is really important,
I know.
especially when
Probably
they're
sounds
older.
a little weird to most
Yeah.
people, but
No, I do too. I'm like, what are you doing? Are you interested?
Yeah.
Like what's happening?
as far as pain management goes, the first thing that comes to mind is pain medication.
Yeah.
Are there any natural like supplements or any other ways that we can deal with pain management aside from pain meds? Let's just say, assuming somebody didn't want to put their dog on pain meds.
Yeah, well, I think that's a really good question. Things that you can do at home, of course, are going to be changing the environment. So environmental modification. So is the water bowl and the food bowl close to where your old dog hangs out?
Okay.
Are there mats, non-slip carpets or yoga mats places so that they're not slipping on that tile or that hardwood floor? Because that, can you imagine if you like have a neck and you like strain your neck muscle or something like that when you're older too, that affects them.
Or even like a bad leg and your hip and your leg
You slip
slips
it.
out.
Yeah,
Yep.
absolutely. Do you have an orthopedic bed for them or a place where they can be comfy that's close to the family? Are you, is there a way where your old dog can go out doesn't have to travel like throughout the house and go downstairs to go out to go ask to go potty, right? Is there a way where there's a front entrance or that they can go to ask a potty? So just environmental modifications at home can certainly be helpful. I think diet is really helpful. So there's a lot of like things like joint diets out there that are really good, that have high levels of omega-3s in them, really good levels of protein in them to support that muscle mass. As long as if it's a senior, as long as they can tolerate that, because there's some diseases where they need restricted or like moderate protein or a little bit lower
like
protein.
kidney disease,
Yeah, exactly. Like kidney disease. So those are things that you can do for sure. There are supplements that can help support joints too. None that I mean, that I really can think of that necessarily help with pain, although CBD is one that does have, we still need a lot more data behind it, but it has been shown to decrease some pain scores in some of the studies that we have that are out there. I wouldn't use CBD as a standalone pain medication or pain, supplement for a dog yet, because we just have things that work so much better, that we have a lot of data behind that work really well for it, which brings us to the last thing, which was what you mentioned, medication. So doggy NSAIDs, so doggy anti-inflammatories, help 80 to 90% of dogs with arthritis. We have studies that suggest that.
How safe, I would say, is it long term? Like, should people feel okay giving something like NSAIDs to a dog or pain medication long term? Or should they take breaks in between and supplement it with like a more natural homeopathic approach?
It's a really good question. I feel like most dogs, when they have chronic pain as they get older, that chronic pain is going to worsen, right? Because like a disease like arthritis, that only gets worse as they get older. And so for me, anti-inflammatories do come with some risks, which is important to know about, right? They could potentially exacerbate kidney disease or liver disease with them. That being said, there are many of my patients and most of my own dogs I have myself that will be on them long-term when they're older, because I want the best life that they can have for as long as possible, right? And so things that I'll do is I'll check their lab work every 4 to 6 months and monitor that and make sure I'm not seeing elevations or things that might tell me to say, okay, like let's take away this med and try to do something different or try a different medication. He's not able to have this one anymore.
Well, I really appreciate the insight, because as Logan ages, I can start to see him moving a little slower. And to be honest, I would rather put him on something more natural, but after this conversation, I'm definitely more open, especially knowing that we could always monitor levels and make adjustments as needed. I've been loving this conversation. I can talk forever. I want to jump into the Ask Me Anything section.
Sure.
So let's jump right in.
Okay.
I got my little iPad here. All right. My dog typically has pretty terrible breath. Okay. How can I tell if it turns into dental disease? Will it be very noticeable?
It's a really good question. So it actually kind of highlights, and we didn't even get to touch on this because we've been talking so much, but about some of the key signs that we can see with dental disease.
Okay, yeah.
Bad breath is one of them.
Okay.
And so halitosis is one of those signs. Certainly, if you're noticing bad breath in your dog, that may indicate that they have a rotten tooth in their mouth.
Okay.
And that could be a sign that you need to get them in to possibly get a dental done under anesthesia. Gotcha. So bad breath, I also think about dogs dropping food sometimes, dogs being less like excited to go to their food bowl. Maybe they're picking around the hard food in there a little bit more, or they're taking longer. Or if you lift their lip up and you see red or brown or black or green colors there, that's an indication they probably
in the gum, or like
on like just a combination, like because a lot of people some dogs don't let, they don't let you look at your teeth. So some owners are just like, they get the lip just a little bit and there's just like a flash of color. You're seeing things like red on the gum line, of course, but if you're seeing calculus, like that yellow or that brown tartar that's on there, that can be a sign that they have to have a dental done, right?
Gotcha. Okay.
So those are other signs that you can see with them.
Real quick, so I feel like most people would say that, well, dogs have bad breath. That's kind of a thing, they're putting their mouth a lot of places that they probably shouldn't, or we definitely wouldn't. So what would be like a difference in what we're smelling?
Well,
if you could maybe describe it a little bit.
Yeah, I think it's so funny because there's like puppy breath and stuff.
Yeah,
and just eat that, like bottle that up and spray it on us, basically. Yeah. But I think that certainly most dogs have some degree of dental disease. Okay, so if you haven't done a dental in a while and you're noticing that your dog's breath smells, it's time.
Get them checked.
It's time. Yeah.
Okay. Yeah. I love it. All right, next question. Are joint supplements helpful for dogs, and can all dogs take them?
I think that joint supplements can be helpful. I think most joint supplements don't they're not pain medication, but most of them, Logan does big
What's up,
stretch,
bud?
Dad. But most supplements that dogs take, like glucosamine or green mussel extract, those can certainly be helpful in supporting
Okay.
joints. There's some evidence that they can help support joints. It's a little bit mixed, but I do think they can be helpful for supporting healthy joints. I always tell people, if you're thinking about taking a supplement, whether it is glucosamine or CBD, whatever it is, talk to your vet about it before you do it.
Okay.
Because even, CBD, we've seen for some of those, it can actually cause an elevation in a liver enzyme.
Okay.
Right. And so we want to make sure we're talking to our vet about it.
Can dogs have phantom pain from a previously chronic pain? And if so, how can I help support my dog if they're having an episode?
Yeah, certainly dogs can have different things, such as, like, it's called allodynia, which means that, if like they have a more excessive response to a stimulus than they would have otherwise. So something like a feather goes over their back and then it hurts them. They're like, whoa, like that hurts a lot. So they certainly can be prone to things like that. For dogs where you think that is something that they have, you really do need to have a veterinarian involved to help you get involved on a chronic pain management plan. I think every dog needs a chronic pain management plan, whether it's non-pharmaceutical, we talked about, like, food, diet, environmental modification, that stuff, or involves medications.
If you don't mind, we'll jump into that, because I'd love to hear more about that. So a pain management plan.
Yeah. I think all old dogs in particular, I mean, all dogs, of course, but like, I think all senior dogs need to have one because chronic pain is so prevalent in them and they're such at risk for it. And so really just this idea of, like, every time you go into the vet, doing a check-in with them and being like, do you think they have chronic pain anywhere? And be like, what did your exam, like, do you feel like on your exam that it's worsening or progressing? Like, where are we at? And doing a checkup. Chronic pain management plans have different aspects of them. Like we talked about, the things we can do at home to help them, and then the things that we can do through a vet to help them too. And I think that every dog should have one. I think rehab should be a really important part of that. So making sure we're, starting earlier for dogs and being proactive and helping them maintain their muscle mass. Rehab is no longer a thing that we just do for dogs, after surgery, or the agility dogs because they're running around. It's a thing that probably every single dog probably really should start doing to help maintain their strength as they get older.
I see. So more like a preventative / quality of life assurance.
Absolutely.
Yeah, I love that, because honestly, I mean, when you were saying that, I thought to myself, that makes so much sense, because if you were to contact me and say, oh, I have a puppy, we're going to put them on a training plan and a socialization protocol to get them into the world and in life. And so that they're the dog that you want, obedient, well-behaved, well-socialized, integrated into the world. You can take them to restaurants, you can take them camping. But I never thought about actually having a pain management protocol or plan where we ensure that the dog is living their best life in their senior years. And it's almost, honestly, I'm blown away right now, because I would only think to implement something like that if I knew that my dog was currently in pain right now, and not something from like a preventative perspective.
Right.
So yeah, that's really awesome stuff. Thank you.
Of course.
Speaking of puppies, I just got a puppy and my older dog is dealing with hip pain. Any tips for managing their playtime to prevent injury for my older dog?
Antonio, I actually want to have you.
Oh my God.
I'm curious what you would think.
Yes, I'm reading this. I'm like, I want to answer this question. Get a leash.
Yeah.
Okay. All right. We're going to do a quick deep dive. Get a leash, number one. And I always tell my clients, a puppy is not, your older dog, your resident dog is not your puppy's play toy, right? It's not your older dog's job to play with the puppy. It's your job to play with the puppy. It's your job to advocate for the older dog and set those boundaries. And another thing too, I would say, is don't punish your older dog for setting boundaries. I see that way too much in my world, where people are just, they are mad at the dog for growling or snapping at the puppy.
Yeah.
And it's inappropriate. I say, look, they're trying to set a boundary. You should advocate for them and help them limit the need to actually respond in that way. So that's it for our questions. I'm so grateful to have chatted with you. It's been such a pleasure. I love the information. You've literally changed my whole perspective. I need to get him on a chronic pain management protocol right now.
Yeah.
And thank you so much for being here. Honestly.
Thank you so much for having me. I appreciate it. I had a great time chatting.
Likewise.
Yep.
Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.